are that you've probably heard of loads of different fertility, infertility, IVF myths. I think it's really important, just because of a lack of general education out there, that we set the record straight on some of these. So here's my take on the most common myths. The first myth is that infertility is predominantly female related, and this of course isn't true, because the man could be affected as well, or it could be a combination of male and female issues as well. And the other thing to say here is that it's not just heterosexual couples who are affected as well. We have a growing number of same-sex couples who wish to have children and who therefore need to seek fertility treatment. Also men and women who aren't able to have children themselves, either because they haven't got their own eggs or sperm, or men and women who may need to use a surrogate to help them to conceive. So lots of reasons why infertility isn't just female orientated. If a man can ejaculate or his sexual performance is good, it means there can't be anything wrong with his semen. Well, this, I'm afraid, is not true. Quite often when we pick up semen analysis results, there's absolutely no indication necessarily that there is anything wrong. An abnormal semen analysis does not mean that a man has problems with erectile dysfunction or with ejaculation. However, if a man does have an issue with ED, sometimes it can mean a low level of testosterone, and problems with ejaculation can sometimes mean things like retrograde ejaculation. So there is a little bit of truth, but not much to this statement. The one I hear all the time is that Clomid or clomiphene can help anyone to get pregnant. And this is simply not true. It's not a magic potion that we can just give out that will help anyone to get pregnant. And in fact, giving Clomid unnecessarily to women can help to hinder their cervical mucus and any sperm that might try to penetrate that. So in fact, could present an obstacle. Certainly, if a woman has polycystic ovaries or irregular ovulation or absent ovulation, Clomid may be helpful in this circumstance, but always needs to be prescribed by your doctor, and ideally with a full assessment, because if you've got blocked fallopian tubes or a male fertility problem, Clomid is not going to help. Does being subfertile mean that you can't necessarily get pregnant naturally? Well, no, it doesn't. There are very few cases that mean that a man or woman is completely sterile. So for a guy, this is where he has complete absence of any sperm, or what's called azoospermia. And for a woman, this is where she has absent fallopian tubes, or both fallopian tubes, which are blocked to make it impossible for the sperm to reach the egg. But in the majority of cases where patients or couples or men and women are deemed to be subfertile, it's possibly because of things that could still mean they can conceive naturally, though the chances are low. So for example, a woman with really low ovarian reserve or a low number of eggs could still potentially get pregnant, though the chance of this is very low. Does being young prevent you from having any fertility-related problems? I'm afraid it doesn't, and infertility can affect anyone at any age. In fact, 1 in 10 women under the age of 30 could experience problems having a baby. And that's because infertility isn't necessarily always associated with aging. There are also other factors that could mean someone struggles to have a baby. Another really common myth is that IVF is a cure and it doesn't matter what age you get pregnant. So whereas IVF is really helpful and has allowed us to be able to allow people the chance to have babies later on in life, I'm afraid it isn't necessarily a cure. So the chance of IVF succeeding in a cycle is about 33% in women under the age of 35. Between the age of 38 and 40, this almost halves to about 17%. And between the ages of 43 to 45, the chance is around 3%. So age absolutely does matter for both men and women, as we're finding. However, there is also the option of using donor eggs if you do find yourself struggling because of age-related decline in your fertility. Is the chance of a twin pregnancy much greater with IVF? Well, this used to be the case when we used to do double or even triple embryo transfers. Nowadays, most experts will do what's called an elective single embryo transfer. And this is because our culture techniques are now so good that we're able to predict how good an embryo is. And for the majority of women, it is the most appropriate decision to make. However, there will be some women who elect to have a double transfer. And in this situation, the risk of twins is going to be higher. But in truth, because we regulate this with IVF so much, the higher chance of twins comes with drugs such as Clomid. And this is why it's absolutely crucial that if you are taking Clomid, you get regular scans and you're seen by a doctor, because if you have several follicles that are growing and developing on your ovaries, there is a chance that you may have more than twins on board, and this in itself could lead to very significant obstetrics or pregnancy-related risks. If you persevere for long enough, you'll eventually get pregnant. So this is a bit of a myth, though I am absolutely, completely in support of people being incredibly committed, which they need to be towards the whole process of getting pregnant and enduring all of what that will involve. I'm afraid there are no guarantees with this, and sometimes no matter how hard someone tries, it can be really, really difficult falling pregnant. And sometimes it's also not the appropriate thing. So there's a lot of time and cost and emotional strain that's involved, which needs to be taken into account. So if anyone you hear says this, I'm afraid this is an oversimplification and is not true. If you've had a kid, does it mean that you won't ever have any fertility related problems again? Well, I'm afraid this isn't necessarily true, and this is because secondary infertility is fairly common, and quite often there are gaps of a couple of years between when people choose to have their children, and within those couple of years actually what can happen is a whole range of different things. You may develop a new condition, and the age itself may have an impact on your egg quality or sperm quality. So this isn't the case, I'm afraid, and people who have had children before absolutely can go on to have problems later. Can diet and lifestyle improve your subfertility? Well, I'm a big fan of improving your diet, looking after your exercise and fitness, and also trying to reduce your stress. These are absolutely all really, really important things that can totally improve your fertility. However, there are some instances where, for example, you may have blocked fallopian tubes. So these are anatomical issues that won't necessarily be reversed just by diet and exercise, and you do need further intervention. So yes, it can absolutely help, but there are sometimes reasons where we need to medically or surgically intervene to help. Are herbs and supplements harmless ways to improve your fertility? Well, supplements are really common. A lot of them contain antioxidants and important minerals and vitamins that can help to supplement our diet, especially if your diet isn't that great, but nothing will compensate for a poor diet. So this is the first thing that you need to change. And then absolutely, it's really important to take folic acid or folate to help to protect the baby as well. Certain herbs are also becoming increasingly important, but it's impossible to say whether they're harmless or not. And in fact, some of them could interfere with certain medication that you're on. So I wouldn't advise you to take any herbs outside of what's prescribed by your doctor and what's overseen by them, because some of these things could have interactions that we just aren't aware of. So be a little bit careful when it comes to that. Can taking anything or anything you do improve your egg quality? So this is a really, really big one. I get asked quite a lot. And yes, whilst taking certain supplements, antioxidants, having a good diet, watching your toxin exposure or minimizing that is really important for preserving good, healthy eggs and trying to prevent any further DNA damage. There is nothing, I'm afraid, there's no magic elixir that is going to reverse any of the aging process that has already occurred. And so supplements and things which sometimes people take, like DHEA, is one that I would not recommend, because there is now a body of evidence which is suggesting that this could be harmful. Other things such as melatonin or growth factor, there's no particular evidence behind the fact that they help, and some of these things may transiently help to boost egg numbers, but not necessarily quality. So be careful about what you believe out there regarding that. The only thing at the moment in the foreseeable future that might potentially help that is stem cells. So trying to culture and grow cells which have the potential to produce new eggs. But aside from that, we haven't found a magic cure yet.